Hi, this is Nick and Sarah Peterson from Indianapolis. We're going to talk to you today about why you might want to do travel physical therapy and what the pros and cons are.
So the first main pros of doing travel physical therapy are A, the pay, and B, the fact that you get to travel. So for the most part, the travel physical therapist pay is about 50 to 75% more of what you would be able to get in a permanent job. And then the other pro to go along with that is that you can get that pay almost anywhere throughout the United States that you want to, as long as there are jobs in that area.
So what are the cons? So the number one con is that as soon as you start a job, you may find yourself thrown into it. So a lot of people don't like to do it as new grads for this reason. Some people do. But many times you may have to learn a brand new documentation system basically in just a few hours, and then you may be starting with new evals that afternoon or the very next day and be somewhat lost. So the first week or two may be really stressful. Not necessarily, but sometimes it may be.
So what happens if you don't like your travel job? Well, that's the other pro, is that if you don't like it, you're only there for 3 months. So really you can stick that out. But if you really hate it and you're having just all kinds of problems, or say there's some ethical dilemma that you're not comfortable with, then there's still the opportunity to give your 30-day notice on both ends, the employer and you. The other side of that, if you do like where your placement is, then a lot of times you'll have the opportunity to extend your contract. So you can stay there another 13 weeks and then you can avoid some of the costs of moving again. And if you're looking, maybe you really like it, you like the area, you think you may want to settle down there, they may even offer you a permanent job.
Another con is that the majority of the jobs are SNFs. So if you really hate SNFs, you're not going to have as much choice in your location. So you still can do almost all outpatient possibly, but you have to be willing to sacrifice location and maybe not go exactly where you want to go. So about 3/4 of the jobs are SNFs with a lot of the places.
And through this whole process, you'll be meeting all kinds of new physical therapists. So you're going to see all kinds of new ways to treat different diagnoses. You'll learn a lot from other people, as long as they're willing to take the time to teach you things and talk with you, which we're all pretty cool in the PT world, so I'm sure everybody would. We haven't had any problems with that so far. In between assignments, you can take off as much time as you want, really. Now there are some caveats to that. You have to worry about your insurance coverage and some other things, fine details, but for the most part, you can take as much vacation time throughout the year as you want in between your travel assignments.
Another one is that you're going to have to move often, so that's kind of cool in one way because you get to see a lot of new places, but number two means you have to find new housing that often. So many people are type A and like to have things planned out far beforehand. If that's you, then you'll have an adjustment because a lot of times you may not get your jobs till 2 to 4 weeks before your assignment. That's actually pretty typical because you are a commodity and employers are basically getting you because they have a need ASAP to fill a job. So that means they're not going to be interested in looking at you 6 to 8 weeks out many times. A lot of times it'll be 4 weeks and under. A lot of times it's kind of difficult finding housing. A lot of people get it off of Craigslist, but sometimes we found there's nothing good on Craigslist. Airbnb is another option, but it can be very pricey. And then what you'll have to with then is basically trying to find short-term leases, which add a lot of times $200 a month to your rent, or corporate housing, which is really pricey. We'll tell you guys a little more about the housing options in another video. So another thing is the tax-free benefits. Those come because it's assumed that you're having duplicate housing expenses, that you have a home somewhere and now you're paying for rent another time. So you have to have a tax home, and that's a complicated subject that we can post more info on. But I found that out at the last minute, and that's something that you really have to look into a lot because you'll need a tax home to get your tax-free benefits. The last con is that you'll be away from family and friends. So you may be close enough in some places of the country that you can visit them, but many times if you're, say, on the East Coast and your family's on the West Coast, you may not see your family for a pretty long time. So that can kind of get old sometimes, not being able to see your friends and family as often as you would like. It's also kind of hard to get integrated into a local community if you want to do that when you're only there for 3 months. So you definitely can to a degree, but it definitely takes some effort on your part.
But on the other hand, you get to make all kinds of new friends along the way. So you're meeting all kinds of new people as you go, and you're getting all different experiences. You get to see what other therapists do to treat a certain thing that you may not, be aware of. And you get to experience a lot of different settings too if you so choose. If you don't want to experience them all, well then talk to your recruiter about that. But if you're not sure where you want to end up in the long run as far as skilled nursing or outpatient or acute care, you can trial all of those during your travel experience and figure out where you may want to end up long term. How cold is it out here, Nick?
It's about 0 degrees with wind chill, or maybe below.
I can't feel my fingers anymore, so
yeah,
we're gonna have to go.
It's cold as crap. Yeah. We hope that helps you guys to maybe have a better idea of whether physical therapy might be something that's right for you. If you have any questions or comments, feel free to leave those below and click the like button and to subscribe if you'd like to see some more videos like this.
Nicholas, are you warming up?
No.
Your hands look pretty red there. I can barely feel my lips.